Okay.
You know what? Now I just don't know. Okay, slideshow from beginning. All right, can you see it? The slide?
Yes.
Yeah.
All right. And God, what is this? Give subtitles a try. No, shut up. Don't give me subtitles. Okay. All right, let me just make sure. All right. On 3, 2, 1. Hey, what's going on, everyone? From Malcolm X College, you're watching Nursing Power.
Points.
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 We got to get that together. I'm Tianna Walker.
Stephanie Sanchez. I'm Ivette Torres.
I'm Kattia Soto, and I'm Dulanas. Today, we're going to talk about the Black maternal mortality in the United States. We're going to talk about the Black Maternal Health Momnibus Bill of 2020. We'll talk about how it addresses related problems like systemic racism, implicit bias, social determinants of health, data collection, shackling pregnant inmates, and maternity deserts. All right, let's start over.
Hello, I'm sorry I'm late.
Oh, she's
Okay.
here.
I just lost the track of time.
It's okay. All right, we're doing a starting from the top again.
Okay.
And share screen again.
How are we going to jump in here with this word points? Because we're supposed to be saying it together, right?
Okay, so I'll just go like nursing power, and then I'll go like points. So I'll just do this sign.
So when you do that, all of us scream points.
Yeah.
Okay. I like that.
And then again at like and
at
then
the
end I'll just be like, please.
Okay.
All right. You see the screen?
Yeah.
Why is everything in pink? Is that normal?
What do you mean pink?
Yeah, mine was like that too. When I opened it up, I don't even know.
Okay, I just refreshed it now. It's fine. Okay.
Okay.
Wait, am I still doing Stephanie's part?
Yeah, still do Stephanie's part.
Okay.
We'll just do this. Okay. Did that change anything? Or
It's pink again, but it's okay.
Okay. All right. 3, 2, 1. Hey, what's going on, everyone? From Malcolm X College, you're watching Nursing Power.
Points.
I'm sorry, I'm Tianna Walker.
I'm Stephanie Sanchez. I'm Ivette Torres.
I'm Kattia Soto.
And I'm Dulanas. Today, we're going to discuss the problem of Black maternal mortality in the United States. We're going to talk about the Black Maternal Health Momnibus Bill of 2020, and we'll talk about how it addresses problems like systemic racism, implicit bias, social determinants of health, data collection, shackling of pregnant inmates, and maternity deserts. Tianna, take it away.
All right. Good afternoon, everyone. Today, I want to talk to you about Kira Johnson. She was smart, energetic, educated, successful, and healthy. This woman ran marathons, raced cars, spoke 5 languages fluently, and was a pilot. Her husband, Charles Johnson, said Kira was sunshine personified. On April 12, 2016, Kira gave birth to her second son by way of a scheduled C-section. There had been no reported complications with her pregnancy, and everything was supposed to be fine. This should have been one of the couple's happiest days. Unfortunately, that was not the case. Hours after surgery, Kira began to feel ill. Her husband noticed a pink tinge in her catheter and informed the medical staff. They drew her labs, and at about 5 p.m., the labs showed all her blood levels were abnormal. A CT scan was ordered stat that was never performed. Hours passed as Kira would become more and more ill. She began to look pale, tender to the touch, and shivering uncontrollably, showing obvious signs for a need for medical attention. Mr. Johnson continued to inform the medical staff, at which one time the nurse said to him, "Sir, your wife is just not a priority at this time." He was repeatedly dismissed, and his concerns were downplayed or ignored. Meanwhile, time is ticking, and Kira is still not receiving the medical care she needs and deserves. Finally, an ultrasound is performed and they could see fluid in her abdomen. That is when she was declared a medical emergency and they took her back to the operating room. The doctor that performed the surgery assured Mr. Johnson that these things sometimes happen and that she would be fine in about 15 minutes. But as they approached the double doors and he was not allowed to go any further, that would be the last time he would see his wife alive. After about 12 hours after giving birth to her son, Kira was dead. During the C-section, the doctor lacerated her bladder. When they opened her up, she had 3.5 liters of blood in her abdomen. She hemorrhaged to death. This is not only sad because the man lost his wife and 2 boys lost their mom, but it was preventable. Kira did not have to die.
Kira Johnson's story and the stories of many other Black women inspired Vice President Kamala Harris to partner with Representative Lauren Underwood. If you don't know her, she's a nurse here from Illinois, and Representative Alma Adams to introduce the Black Maternal Health Momnibus Bill of 2020 last year. Last month, this bill was reintroduced to the new Senate by Senator Cory Booker with the support of 17 other Democratic senators. This legislation is intended to save moms' lives, end racial disparities in maternal health outcomes, and achieve maternal justice for Black women. The Black maternal mortality in the US is a big problem that includes many factors. We know for sure that Black women are dying at higher rates than other races. There is also systemic racism and implicit bias in healthcare. The data collection for maternal mortality is inaccurate or not existent in some states, and many more. Tianna is going to tell us a little bit more about Black maternal mortality.
Okay, so I just shared with you one of the many cases that is increasingly becoming a major problem in the United States, Black maternal mortality. The US has the highest maternal mortality rate of any developed country, and African-American women like Kira are overly affected. The CDC reports that they are 209% more likely to die than white women. Since 1987, the CDC also reports there has been a significant rise from 7 deaths per 1,000 births in 1987 to currently 17 deaths per 1,000 births. And African-American, Native American, and Alaskan Native women are 2 to 3 times more likely to die from pregnancy-related issues than white women. And then there's systemic racism, also referred to as institutional racism. It's a form of racism that has been embedded as normal practice within society or an organization. It can lead to discrimination issues in the system that help run our country, such as the criminal justice system, education, employment, and our healthcare system. I'm not saying that one system is more important than the other. It's just when I think of healthcare, I think of people's lives where they live or die based on the ignorance of a person who is supposed to be there to help them. It's been said that Black people are less likely to be offered the same treatment options and healthcare and health resources as Caucasians. And on the flip side to that, Blacks are also more likely to be unnecessarily screened and tested for diseases and disorders. In addition to the systemic racism, we have the implicit attitudes, which is just defined as thoughts and feelings that often exist outside of our conscious awareness. And that makes it difficult to acknowledge or control. Kattia will elaborate a little bit more on that.
So Tianna just talked about one of the leading social determinants of health inequities, systemic racism. Social determinants of health are conditions in the environments that affect people's health, their risks, and their quality of life outcomes. Some of these are poverty, housing, transportation, and access to healthcare. Communities of color face more restrictions on housing options, jobs, and education, which finally ends in marginalization and inequality cycles. Poverty and housing are directly related to government policy. Housing insecurity exacerbates health conditions in all patients, pregnant included. This stressor can be harmful to pregnant women and babies who could see low birth weight due to an insecure housing during pregnancy. Here in this graph, we can see the big gap that exists between Black and white home ownership rates. In 2014, more than 71% of the white population were homeowners, compared with just 41% for the Black population. Transportation is also an issue that affects Black mothers. Black women are more likely to rely on public transportation and encounter transportation challenges and delays when accessing healthcare. Being late or missing a medical appointment frequently happens to patients depending on public transportation. Also, in some areas, there are not enough healthcare providers to serve some communities. This graph shows the pink areas where more maternal care is available for women, but also shows all the big red areas where women don't have maternal medical care access at all. These areas are called maternity deserts, and Ivette will talk a little bit more about them.
In a country such as the United States, one would think citizens would have access to the best health care. Unfortunately, that is not the case for women of color and women in poverty. There is lack of prenatal health care in a large geographic area, lack of information available, and unnecessary medical procedures. And I'm going to talk about how the Momnibus bill would invest in community-based organizations to grow and diversify the perinatal workforce, for example, doulas. So first, I wanted to talk about the 3 delays models. It is a model that explains 3 phases that affect maternal outcomes. So the delays are 1, decision in seeking care, 2, reaching care, and 3, receiving adequate care. These delays can result in health deficits. For example, we have a population dense map of Georgia, which distinguishes rural hospital closures between 2010 and 2017, as well as areas where hospitals are accessible within a 30-minute drive. In the map, the areas with enclosed circles are rural hospitals that closed between 2010 and 2017. The yellow sections are areas where there is within a 30-minute drive of a closed rural hospital, but not within an open hospital. The section in blue are areas where the drive to a hospital is for more than 30 minutes. So bringing a child into the world can be emotionally, physically, and mentally draining. We expect that a nurse would constantly be by our side, but in reality, nurses spend 6 to 10% of their time in labor-engaged activities. The Momnibus bill seeks to invest in community-based organizations to improve Black maternal health outcomes. One of these investments is doulas. They are non-medical professionals that guide and provide informational support of women intrapartum and postpartum. 40% of women are unaware of the support a doula can provide, and low-income African Americans report wanting a doula, but unable to do so due to their socioeconomic status. So we have previously talked, many Black mothers are deserted, not given priority, and experience racism and microaggressions. Doulas have witnessed doctors coming to a woman's room, shoving their legs open and performing a pelvic exam, all without their consent. Also, doctors prefer her to have a quick labor and perform C-sections, which can result in a longer recovery. Doulas provide information on the options that are available, and a doctor's choice is not the only one. Doulas can play an advocacy role. They help women recognize how they are being treated unfairly and speak on their defense by either change of medical staff or holding them accountable for their actions. So with a doula by their side, there have been a decreased cesarean rate and increase in APGAR scores, shorter labors, and increase in breast initiation and retention. They are also faster and cheaper to train than doctors and nurses. They can be spread out through the maternity deserts. So African Americans have mistrust in the healthcare systems due to racial history. It is not easy to trust the medical staff. By investing in community-based doulas, a strong relationship can be formed, and doulas can provide culturally competent care in their communities. So through our research, we found that there is a major issue with the data collection processes. For many states and hospitals, the data is either non-existent or inaccurate. Data collection is voluntary in certain states, and some hospitals are unwilling to release public info on maternal deaths. 29 states lack maternal mortality review boards. We need accurate data and transparency to be able to hold the powers that be accountable to address these issues. Georgia is a good example. They stopped collecting data for 12 years. The CDC is pushing for standardizations of state-level reviews. We need a national tracking system that every state and hospital uses consistently. AIM, Alliance for Innovation for Maternal Health, is a tool used to collaborate with hospitals to track, share hospital data, determine progress of patient safety and outcomes. A lot of states have jumped on board to use this tool. It is important because every classified or unrecorded data is a lost opportunity to ensure other mothers and babies do not die in the same way.
The Momnibus bill addresses the atrocious practice of shackling pregnant inmates because it directly impacts Black infant and maternal outcomes, maternal health outcomes. Shackling is the unnecessary practice of using physical restraints to prohibit violence or escape. Our research found in 2018 that there have been no escape attempts reported among pregnant inmates who were not shackled during birth. There is no strong federal legislation regarding shackling. The federal government provides loose guidelines that are more like suggestions. Legislation has been delegated to the state level, and only 22 states have official laws that limit shackling. In 28 states, anything goes. 4-point restraints, shackles to the bed, both feet shackled, both hands cuffed behind your back, even solitary confinement. Pregnant inmates and their fetuses are at the mercy of individual jailers. Now let's talk about how shackling affects infant and maternal mortality. Restraints increase the likelihood of falls. Just imagine, you're pregnant with your first child and you have cuffs on both your feet. You're dizzy, your center of gravity is off, and you try walking to the bathroom and you land on your stomach. Now, imagine you're 7 months pregnant, and you have your hands cuffed behind your back. You're dizzy, you try to go to the bathroom, and you land on your stomach. So falls like this can cause complications like placenta abruptio, which can lead to fetal death. Shackles prevent pregnant inmates from taking non-pharmacological methods to relieve pain. They can't walk, they can't reposition, and now this is where shackles affect healthcare workers like you. Shackles limit the ability of healthcare workers to assess and provide care. Because healthcare workers can't rely on non-pharmacological methods like walking and repositioning to relieve pain, they begin to rely heavily on pain medications. These pain medications increase the likelihood of falls. Just look at this slide. We literally and figuratively have a cycle of pain and death, and it's acceptable in 28 states. Anything goes. All right, here's a clinical simulation for you. This photo is from an article published in 2016. Here's your patient, 4-point restraints, supine, variable decelerations. I'm the officer with the key. Take 5 seconds to think. How are you gonna get her in this position in the photo? What are you gonna say to me? Okay, time's up. I'm sure we had some great responses, but none of that matters because I'm the officer with the key. I don't have to do anything. I don't care. There are no federal guidelines, no federal legislation on this matter, and no states that ban, and the state that we're in doesn't ban shackling. So get over it, back up off me, get back to work. Forgive me for my crass acting, but the simulation shows you that pregnant women and their fetuses are at the mercy of individual jailers in 28 states. The Momnibus bill will provide enforceable federal legislation on this matter. The bill does this by reducing state grants from a previous law by 25%. If the state does not have a law restricting the use of restraints on pregnant inmates. So if the state just makes a law providing the bare minimum of care, like banning ankle shackles and 4-point restraints, they get their money back. This photo here was taken in Iowa in 2020. Back to you, Kattia.
So how is the Momnibus bill going to solve all these problems? First, the bill will put $25 million toward fighting racial bias in medicine by ensuring medical schools, nursing schools, and other training programs to include implicit bias training as part of their curriculum. The bill will also start the process of national data collection by offering training programs and financial grants for all states and intends to include social care into clinical care, such as investing in digital tools like telehealth in underserved areas, in addition to free transportation, mental health programs, and housing programs, among others. As just mentioned, the Momnibus bill attempts to end the practice of shackling pregnant prisoners. by creating financial incentives for the remaining 28 states that they don't have laws against this practice. The bill also seeks to grow and diversify the perinatal workforce, such as including doulas in doula programs to help bridge the racial equity gap when it comes to racism and decreasing the maternal mortality rate.
The Momnibus bill.
I got it. Let me get it. The Momnibus bill was introduced by then Senator Kamala Harris, I know, in March 2020. It currently has 17 Democratic co-sponsors and 0 Republican co-sponsors. The future of the bill is uncertain due to the slim Democratic majorities in the House and the Senate. So let's keep our fingers crossed. I added that. Okay. The day before Mother's Day in 2017, Charles Johnson decided to share Kira's story because there have been so many others with stories like theirs. He decided this needs to be addressed, needs to be heard and addressed. Mr. Johnson sued the hospital for medical negligence and also testified before Congress. His fight inspired the Momnibus bill. He also started the social media handle and hashtag @4Kira4Moms and hashtag Kira for Moms on Facebook, Instagram, and Twitter to help keep her legacy alive.
So you're probably wondering, how can I help? The best way to get involved is to call or message your senator. Ask them to support this bill. We have made it easy for you to get involved. Go ahead and type your email address in the chat or private message Ivette with your email address, and we'll give you a draft letter that you can send to your senators. It's easy, 5 minutes and you're done.
Here are our references. Well, there you have it. Leadership Project 2021, done, son. Don't forget to like and subscribe below to let us know that you love this content. Do you like this nursing content with a chill, everyday vibe? Smash that reaction button in, to let us know. Shout out to Vice President Kamala Harris for introducing the bill. Big ups to Charles Johnson for keeping Kira Johnson's memory alive. And special shout out to Professor Ford Kendrick. Give us an A.
Give us an A.
Thank you to all our classmates for making it to the end, and we'll see you in the next one.
19 minutes.
19?
29 seconds. Yay.
Yeah, we doing okay. We doing okay.